Hello, my name is Dr. Adams, and I'm a dentist at Maryland Holistic Dentist in Burtonsville, Maryland. And today we're going to be talking about full mouth dental implants. And I've been doing a lot of dental implants for the last 20 years, and I run a practice where we do anything from single implants to people need all their teeth removed and replaced. So I'm really simply going to go through the different full mouth implant options, because a lot of times people will be really confused and they end up having to go in and see 2 or 3 different dentists before they can really get some pretty straightforward answers. So first thing I'm gonna do is really briefly just go through the different ways you can replace a full set of teeth with dental implants. And really the 2 big differences in the different ways to have all your teeth, or really like a full upper or a full lower set of teeth replaced with dental implants, is do you want teeth that are permanent teeth stay in your mouth, or teeth that come in and out of your mouth, that is removable teeth? Most people will want the permanent teeth to stay in their mouth, and there are a couple different ways to do that, but the most economical way to have permanent teeth in your mouth is to, for example, if you're going to replace your upper teeth, you can put in 4, 5, 6, maybe 7 implants. Really, you just need as many as you need to absorb the forces of chewing. And once you get those group of implants placed, then the lab can construct a full mouth bridge that will get permanently fixed to those implants. And they, in fact, will get permanently fastened down on the implants, and the intention is that those teeth never get removed. So this type of case is typically called all-on-4 or all-on-6 full mouth implant bridge. And really, it is what the name says it is. It's a group of teeth that support implants that get permanently placed in your mouth, and they do not get removed. Okay, so you got that part. They don't come out, in and out. The second, and that's what most people want. The second thing is a implant denture. So implant denture is where you place some implants in your mouth, and you put these snap-on. And there's like a male snap that goes on top of the implants, and then there's a female snap that's in the denture, and the denture will quite literally snap on to the implants, and that's how they stay in there. Of course, the old school way to replace a full set of teeth would be just to remove all the teeth and get dentures, but as many of you may already know, people don't like dentures. They're really big and they're thick, and they're supposed to stay in the mouth like suction cups. They're not stable. They'll come out while you're eating, talking, and that's what really has sprung all the interest in dental implants. I actually have some examples of these cases. A lot of people, they really want to see what they are. Unfortunately, full mouth implants does not enable you to try these things in your mouth before you buy them. It is also a requirement to get a full mouth implant that you have to have all your teeth taken out. So what you really want to do is you want to try to get as much information so that you know what to expect so that when you have all your teeth taken out and you have them replaced with whatever option you select, that you're hopefully getting, what you're expecting, and that saves a lot of disappointment for the doctor and the patient. I'm going to come over here and get the recorder now, and I'm going to show you these different options. Let me turn the camera around if I can figure this out. Okay, so these are the different full mouth implant options that I was just discussing. This right here is the all-on-4 or the full mouth implant bridge. As you can see, this is a one-piece bridge. Well, I'll take this out and show you what this looks like. And This is the underside of the bridge, and it gets placed on top of these implants that have been placed, and then inside these little accesses, there are little tiny screws that permanently place this bridge. These bridges are made out of a porcelain or a specialized material called zirconia. They're very smooth and highly polished. Again, this bridge stays in the mouth permanently. It is not intended to ever come out. These bridges are made by 3D printers, and they are milled from a block of zirconia. They're very strong. This is the removable denture. I was telling you before that there are little snap-on attachments. In this particular case, it's a lower set, and this particular model shows 2 implants. You can also have 4 implants where there's 2 more in the back to make this a little more stable. But the way this works is, if you look at the underside of here, there are the female side, which literally snaps on, and those have gotten the name on the street, snap-on dentures. People obviously don't like these as much because they do come in and out of the mouth, but I will tell you they're quite stable. Once they're snapped on to the abutments, these teeth stay in there. So for people who really don't enjoy the removability and the instability of some of the old school dentures, this can really satisfy their requirements. For people that have been wearing unstable dentures to get these implants that secure their dentures, this can be a real life changer. One thing that you may notice is that these, well, I'll tell you, maybe you can't notice in this video, but these teeth are made of acrylic, which is a plastic. It's also thicker. You'll also notice that there's a lot of pink, and sometimes people are like, well, geez, do I really have to have all that pink stuff? Most people that are missing teeth have been missing teeth for different amounts of time. So when we make these full mouth prosthetics, this pink tissue here essentially replaces the amount of bone that they're missing. If somebody comes in and they haven't had teeth for years and years and years, and they're missing like this much bone, we can't just like put teeth in there that are floating in thin air. We have to put a prosthetic in there that replaces what they're missing. Otherwise, the teeth will be really short and in the wrong place. So for people that are missing all their teeth and have been missing teeth for periods of time, and they're missing gum and bone, these 2 options are going to come down to the best bet: the full mouth implant bridge or the removable denture. Do want to point out one other thing here. This bridge, it's a lot thinner. Some of my patients don't end up getting nearly quite as much pink gum tissue if they haven't been missing a lot of bone. Sometimes people are like, well, geez, that still looks like a denture, and do I really have to have all that? The bottom line is we only have to replace what the person is missing. The other thing is, this is your classic like all-on-4 case, and it's called all-on-4 because you're putting in literally all the teeth, and it's getting permanently placed down on top of 4 implants. I really don't recommend at all doing just 4 implants. It'd be much better to put 1 or 2 more in there, because God forbid you lose an implant, or 4 is like the bare minimum. So you're going to put all the forces of 12 missing teeth on 4 implants. I always do these cases with 5 or 6, just depending on how big the person's jaw is. And if nothing else, if you put in 5 or 6 implants and you're waiting for everything to heal, and then you get to the point where you're going to finish the case and make the bridge, there's a healing period, and then you put the bridge on there. Let's say one of the implants doesn't work. If you have 5 implants that that actually heal and you lose one of them, you can still move forward and finish the case up. If you go with the bare minimum, this piece right here is very expensive. Let's just say, to be the devil's advocate, you put this on here and everything looks great, and then 1 or 2 or 10 years later, one of these implants fails. Well, guess what? These implants are where they are, and they permanently fix on here in a very exact way. So this whole bridge would need to be remade, and an implant would need to be put back in here. And this bridge, $10,000 plus easily to get that nice piece of hardware made. That's a huge investment to watch go down the drain. I will go over one other option. Some of my patients will come in and they have a mouth of teeth that need to be removed. They'll get to the point where it's just not worth fixing. There's like root canals and more teeth that have cavities, and they need more root canals, and you get down to the point where you got about half the teeth remaining and they're in the wrong place. It really is less expensive, and you get a better result to remove and replace all the teeth. For people that are just recently losing teeth, they can also, instead of getting this one-piece bridge, we can put in 3 individual implants here, and same thing on the other side in the back, and we can put individual teeth for the back teeth, and then we can put small bridges here across the front, and people can have like areas where they can floss, and there's not anywhere near as much pink here. So I offer this other option called full mouth of implants and crown. It's basically implants that connect small bridges and crowns, and you can literally have probably 10 implants and have as many individual teeth as possible in there. Most of my patients will not opt for that option because it's so expensive. The more implants you place, the more the cost goes up. And when you make a big bridge like this, the lab will charge you 1 fee to make the bridge. It's like a cost per unit, whereas if you do the individual crowns and bridges, it's a lot more work for the lab, and they'll charge you by the tooth. These porcelain and zirconia teeth cost a lot more than these plastic teeth. So you can easily see how teeth that are made of plastic that's inexpensive, using fewer implants, that these snap-on dentures are going to be much less expensive. And a lot of times cost will be a big driving factor. Sometimes I'll have patients who will go with this removable option, and they'll come back a period of time later, and they will place more implants, and they'll upgrade to a fixed bridge. But anyway, these are the different types of cases, and now you can sort of see how these things work. I will go as far as to say that these models that the lab makes, these teeth really aren't that pretty. Most of the cases that we do, I know this video isn't the greatest, but the porcelain work looks much more lifelike. Even this plastic denture looks a bit better. But anyway, my name's Dr. Adams, and hopefully this clarifies some of the questions you had about full mouth dental implants.